Hello, I'm Dr. Stuart Frank, professor in the Department of Internal Medicine at Southern Illinois University School of Medicine. Please join us for this edition of Hometown Housecall and learn how the special services of a trauma center in the golden hour can save your life. From there, we'll visit with geriatric physicians and a very special couple for a master's class on caregiving. Our third segment is brought to you by the Simmons Cooper Cancer Institute at SIU. Psycho-oncology is a relatively new field that seeks to provide psychological support in conjunction with other healthcare providers in the treatment of cancer patients and their families. Today's program has even more medical information you can use.
Trauma is the leading cause of death for persons ages 1 through 34. Surviving a major injury and minimizing the chances of a complication or disability depends on an efficient system of highly specialized trauma care professionals.
And our goal is to get the patient to a trauma center as quickly as possible, especially someone who has suffered multiple system trauma, meaning more than just one body system is injured.
Physicians know that pre-hospital care providers are going to give us the best opportunity to save that patient in the first hour, because the golden hour starts when the incident occurs, not when the patient arrives at the trauma center.
You know, it's funny, all of the things that are being done in medicine, and that's so important, but so much of what happens in trauma has to do with common sense, advances in technology outside of medicine. And so I think that's going to continue to change, and hopefully we will be seeing fewer and fewer traumatic injuries because patients are smarter and better protected.
Here's even more medical information you can use.
Night terrors are different than nightmares, primarily because of the sleep stage in which they occur. What happens typically, the scenario is that an hour or two after the child goes to sleep, they'll scream or call out, and actually may sound very anxious or worried or hurt, and parents will run to them. And they may be sitting up and staring but not focused, and parents have a hard time getting their attention, and that's actually because they're still sleeping, they're not awake, which makes it very difficult to calm and console a sleeping child. And this is a sleep stage disturbance, not a true nightmare. They're not going to be able to tell you, no, I dreamt about a monster, or I'm worried about something like this. And in the morning, usually they don't have any recollection of this ever occurring. It's most common in children between ages of 2 and 6, and usually after kind of school age, they extinguish themselves.
Learning to manage the stress and appreciate the rewards of caregiving is the subject of our next segment.
Meet Barbara and Les. Barbara is a former professional community educator with the University of Illinois. Les taught international labor relations and human resources. An avid world traveler, Les earned his PhD at the age of 61. 3 years later, he was diagnosed with Alzheimer's disease.
We've had quite a busy and active life, and slowing down is a little bit of a bump, to put it mildly.
Being a caregiver is, I think, a role that people have thrust upon them that many people accept and manage admirably, and they do wonderfully well and serve the needs of people. Without them, there are many people that would be very debilitated, might die much quicker, might end up in nursing homes much more rapidly.
I need to remember to be ever so much more patient. That is, to me, what is the real challenge of this caregiving experience, is being patient not only with your loved one, but with yourself.
Here's a short quiz. Is it a medical myth or a medical fact that you should never blow your nose when you have a cold? It's a medical fact. During sickness, it could propel viruses and bacteria into the sinuses and possibly cause further infection. The proper method is to gently blow one nostril at a time and to take decongestants. The science of cancer has made great strides, but no technological advance can measure fear or treat the emotional response to cancer. Patients want and deserve not just excellent care, but caring experts. They find them at the Simmons Cooper Cancer Institute at SIU.
Psycho-oncology focuses on treating the individual with cancer and their family from the time of diagnosis throughout survivorship or end of life. The NCCN, which is the National Comprehensive Cancer Network, has established guidelines for screening distress. And those guidelines are fairly simple to implement. There actually is a visual analog scale that's a thermometer from 0 to 10.
Psycho-oncology is part of the Simmons Cooper Cancer Institute's multidisciplinary approach to treating cancer. It focuses on cancer as a disease of both the body and the mind, with the understanding that each influences the other.
Cancer takes so much from the individual who's diagnosed and from their family that the whole point of treatment is to not let cancer take anything else from you. If it got today because you were fearful or depressed, then cancer won a day. And you don't want to give cancer a day.
During the Civil War, amputation kits like this one, on loan from the Pearson Museum, were a part of every field surgeon's kit bag. 3 out of every 4 operations during the Civil War were amputations. Standard surgical practice at that time did not include sterilization or even the washing of hands or instruments. In the mid-19th century, Joseph Lister, an English surgeon, noted that up to 80% of surgical patients developed gangrene. At about the same time, French chemist Louis Pasteur's research pointed to microbes as sources of infection. Dr. Lister began to search for a way to get rid of infectious bacteria during surgery. He thought that an antiseptic environment, a new idea at the time, might lead to better surgical outcomes. In the 1860s, Dr. Lister introduced the use of carbolic acid as a cleansing and disinfecting agent. Until then, carbolic acid had been used to deodorize garbage. His test case was a patient with a compound fracture of the leg. Infection, amputation, and death often followed such injuries. Lister applied undiluted carbolic acid directly to the human tissue, as well as anything else that might come into contact with the wound. Of 11 patients with fractures who were treated with carbolic acid solutions, only 1 died and only 1 had to undergo an amputation of the limb. The success of Lister's antiseptic method of surgery inspired orthopedic surgeon George F.L. Strohmeyer to pen this light verse. Mankind looks grateful now on thee for what thou didst in surgery, and death must often go amiss by smelling antiseptic bliss. By the way, Listerine mouthwash was named after Joseph Lister for his work in antisepsis. The jury is still out on whether Dr. Lister appreciated this tribute. I'm Dr. Stuart Frank, looking forward to our next visit.